Hello, my name is Casey, and I'm currently a registered nurse working in the state of Florida at a hospital on the medical surgical floor. I'm also a student actively pursuing my Bachelor's of Science in Nursing degree. As a nurse, the profession has been very rewarding for me. But one obstacle I face on a daily basis is the public's misconceptions and views on nursing. Many of the public still view nurses as angels that sit at the bedside, or robots that blindly follow doctors' orders, or as sexual objects. The opinion I find most frustrating is that nurses blindly follow doctors' orders. Instead, I want to be viewed as the autonomous decision maker that I actually am. While it is true that in many cases I do follow doctors' orders, there's a disconnect with how often I am the one who intervenes when an order could have caused harm. Through my extensive education, I have learned how to recognize when an order could be dangerous and when I need to intervene on behalf of my patients. For instance, doctors may order a sedative to an alcoholic patient to prevent them from withdrawing from the alcohol while they're recovering from an injury. If I were simply following orders, I would give the medication every 4 hours as it's ordered, and the patient could become too sedated and overdose. Due to my autonomy, I can assess the patient and determine the need for the medication. If it's not safe to give it, then I hold it and notify the doctor. Another example of my decision making is how I can assess a patient at any time. If they seem to be declining, I have the authority to order a team to respond immediately to aid in the recovery of that patient. The team of individuals include respiratory therapists, ICU nurses, and physicians. Multiple times a day, I recognize that a patient has a need for an intervention, a medication, or a test. It is my responsibility to communicate with the physician that they need that test, intervention, or medication. If I don't intervene and notify the physician, many times it could result in patient harm. As a nurse, I understand firsthand the difficulties I overcame in the pursuit of my education. Frequently, the public, however, still misidentifies the educational requirements that becoming a nurse is contingent upon. The only way to rectify this image is for nurses to speak out about their education and change the public's perception of nurses. I believe that nurses serve a vital need to the health and wellness of our loved ones. Not only do nurses work in hospitals and at the patient's bedsides, but many nurses become providers themselves that have their own practice and solely care for their patients. We nurses are highly educated, independent members of the healthcare community, and it is our responsibility to educate the public on the view of nursing. For that reason, I intend to spread a positive image of nursing through this video. Thank you for your time, and I hope this video makes you reconsider the negative images of nursing.